A new pilot study suggests the ketogenic diet, best known for weight loss, may also help ease depression in college students. Researchers found that following a well-formulated keto diet for at least 10 weeks was linked to a roughly 70% drop in depression symptoms among students with major depressive disorder. The study included 16 students who were already receiving medication, counseling, or both. The researchers say adding keto appeared to provide an extra boost compared to standard care alone. The participants received tailored meal plans and support to stick with the diet, which consisted of fewer than 50 grams of carbohydrates per day, combined with higher fat and moderate protein intake. Beyond symptom relief, the results showed the students' overall well-being increased, their memory and thinking skills improved, and most lost weight, on average about 11 pounds. The lead author says because there is evidence of a benefit, expanding accessibility to a well-formulated ketogenic diet as an augmentation to treatment for depression is something to think about. He says while the study was small and did not include a control group, these findings pave the way for a larger clinical trial. About 40% of U.S. college students report symptoms of depression, and only half receive treatment.